Let's begin with a foundational understanding. When we talk about sexual and urological health in both males and females, we're not just talking about reproduction or pleasure. We're talking about a critical dimension of human health that directly ties into mood, cognition, motivation, longevity, immune function, and overall vitality. You see, sexual health is neurobiological. It's psychological, and it's deeply physiological. These systems don't operate in isolation. They communicate constantly between brain, body, and behavior. Sexual and urological health is not isolated to reproductive organs or specific behaviors. It is regulated by a powerful and dynamic loop between the brain, the endocrine system, and behavior. This is known as the hormone-brain behavior loop, and it operates through a set of interlocking feedback systems. At the center of this loop is the hypothalamus, a small yet vital structure deep in the brain. The hypothalamus senses internal signals like stress levels, sleep quality, nutrition status, and social context. It then communicates with the pituitary gland, which releases hormones that signal the gonads, the testes in males and the ovaries in females, to produce sex hormones such as testosterone, estrogen, and progesterone. These hormones, in turn, circulate back to the brain, influencing our mood, sexual desire, physical arousal, and even perception of ourselves and others. This system is highly sensitive to external inputs. For example, a stressful week at work, poor nutrition, or inconsistent sleep can signal the hypothalamus to reduce hormone production. This can lead to decreased libido, reduced sexual satisfaction, urinary discomfort, or dysfunction. Conversely, when the body is well regulated, meaning it gets sufficient sleep, sunlight, nourishment, and emotional safety, the hypothalamus reads this as a green light for reproductive and sexual readiness. In men, this results in more stable testosterone production, better erectile function, and improved urological control. In women, the benefits include better estrogen and progesterone balance, enhanced lubrication, regulated menstrual cycles, and a stronger, more resilient urinary system. Interestingly, behavior itself can influence the loop in both directions. Engaging in sexual activity, or even anticipating it, can increase dopamine and oxytocin in the brain, which then feeds forward into the hypothalamus and pituitary, stimulating hormone production and enhancing the readiness of the entire sexual system. This means that not only do hormones influence behavior, but behavior can enhance hormone levels and system sensitivity. In this way, sexual and urological health is not a passive process. It is responsive to lifestyle, emotional regulation, and daily behavioral patterns. The loop is also tightly tied to mood and motivation. Low levels of testosterone or estrogen don't just decrease physical arousal. They also dampen mental drive and social confidence. Studies have shown that when testosterone is artificially lowered in healthy men, their willingness to engage in competitive or risk-taking behavior decreases significantly. In women, estrogen modulates not only mood, but also memory and cognitive function. Therefore, sexual health intersects with broader domains like decision-making, emotional resilience, and mental clarity. It's also important to understand that this loop is trainable. You can make deliberate interventions to improve the performance of this system. Getting bright natural light within 30-60 minutes of waking resets the circadian rhythms that govern hormone pulses. Avoiding artificial light at night preserves the natural rise of luteinizing hormone and growth hormone, both of which are critical for sexual and tissue health. Regular physical activity, especially resistance training in men and moderate cardiovascular activity in women, has been shown to increase circulating levels of sex hormones and improve sexual desire and function. Mindfulness, meditation, and breathwork calm the stress response and allow the hypothalamus to remain sensitive to positive behavioral cues, One fascinating insight from neuroscience is that sexual and urological dysfunction is often a problem of inhibition, not lack of capability. The prefrontal cortex and amygdala regions involved in fear, self-monitoring, and threat detection can override signals from the hypothalamus and pituitary, effectively turning off arousal or urinary control if the person is stressed, ashamed, or distracted. This is why emotional safety, trust, and positive psychological context are so critical to good sexual experiences. Creating a low-threat, high-safety environment helps deactivate these inhibitory brain circuits and allows the natural hormone, brain, behavior loop to function smoothly. In both clinical and wellness contexts, when we begin to work with this loop rather than against it, we see dramatic improvements. Sexual function becomes more reliable, urinary symptoms decline, and people often report better energy, clearer thinking, and improved relationships. It's not magic, it's biology working as it's meant to, once the inputs are aligned. The key takeaway is that sexual and urological health is a whole system process. It's a dance between brain chemistry, hormone signaling, behavior, and perception. And with consistent, informed effort, it can be enhanced, supported, and optimized over time. Sleep is one of the most fundamental pillars of human health, yet its role in regulating sexual and urological health is often underestimated. Every major hormone involved in sexual function, testosterone, estrogen, progesterone, luteinizing hormone, and follicle stimulating hormone, is governed by circadian rhythms. These are the internal biological clocks that synchronize with the 24-hour cycle of light and darkness. When we align our sleep-wake patterns with these rhythms, our body performs optimally. When we don't, nearly every aspect of hormone production and regulation is impaired. For men, even a single week of restricted sleep, defined as less than 5 hours per night, can reduce testosterone levels by as much as 10 to 15%. This reduction has a direct impact on libido, erectile function, sperm quality, and even mood and motivation. For women, disrupted sleep has been associated with irregular menstrual cycles, increased symptoms of premenstrual syndrome, reduced vaginal lubrication, and heightened urinary urgency or incontinence. Sleep disruption also increases cortisol levels, which in turn suppresses the function of the hypothalamic, pituitary, gonadal axis, the system that controls the release of sex hormones in both males and females. Circadian rhythms are primarily influenced by light. Exposure to natural sunlight early in the day signals the brain that it is time to be awake and alert. This light input is received by specialized cells in the retina, which then send signals to the suprachiasmatic nucleus of the hypothalamus, the brain's master clock. This master clock coordinates downstream processes like cortisol release in the morning and melatonin in production at night. Melatonin, while known for regulating sleep, also interacts with sex hormone production. Poor melatonin in rhythms can interfere with ovulation in females and reduce sperm motility in males. To optimize sleep and, by extension, sexual and urological health, one must get 10 to 30 minutes of bright outdoor light within the first hour of waking. In the evening, reducing exposure to artificial lights, particularly blue light from screens, allows melatonin to rise naturally, supporting deep and restorative sleep. Another critical component of sleep is its impact on growth hormone and prolactin. Growth hormone supports tissue repair, including the tissues of the reproductive and urinary systems. Prolactin, though often associated with lactation, is also involved in sexual satisfaction and refractory periods after orgasm. Both are released in pulses during slow wave and REM sleep. Therefore, fragmented or shallow sleep interferes with their release, leading to diminished tissue repair and lower sexual satisfaction. Deep sleep also regulates the bladder's signaling mechanisms, helping to maintain continence. Poor sleep quality can lead to increased nighttime urination, further disrupting sleep and setting off a vicious cycle. Importantly, sleep affects not only the physical components of sexual and urological health, but also the psychological ones. When people are sleep deprived, their threshold for stress lowers, they become more emotionally reactive, and their desire for intimacy typically decreases. Chronic sleep deprivation is associated with increased rates of depression and anxiety, both of which are known contributors to sexual dysfunction and urinary symptoms. The connection here is bidirectional. Sexual and urological problems can disrupt sleep, and poor sleep can cause or worsen those problems. Recognizing this two-way street allows for a more integrative approach to treatment and health optimization. Practical interventions include maintaining a consistent sleep and wake time, even on weekends, avoiding caffeine after 2 p.m., limiting alcohol intake, which disrupts REM sleep, and keeping the bedroom environment cool, dark, and quiet. Supplementing with magnesium glycinate or the amino acid L-theanine can help promote relaxation before sleep. Behavioral tools like yoga nidra or non-sleep deep rest protocols are also effective in Tao, regulating the nervous system before bedtime, making it easier to fall and stay asleep. Even small improvements in sleep quality, such as adding 30 minutes to your sleep window or reducing screen time an hour before bed, can yield measurable improvements in libido, hormonal balance, and urinary control. In summary, sleep is not a passive state of rest, but an active process of repair, regulation, and hormone optimization. It is a powerful, trainable tool that underlies every aspect of sexual and urological health. By respecting and aligning with our natural circadian biology, we can create the internal conditions for robust sexual desire, reproductive function, and urological resilience in both men and women. Chronic stress is one of the most overlooked disruptors of sexual and urological health, and its biological effects go far beyond emotional tension or fatigue. When the body perceives stress, whether from psychological, physical, or environmental sources, it activates the hypothalamic, pituitary, adrenal HPA axis. This causes the adrenal glands to release cortisol, the primary stress hormone. While cortisol plays a vital role in short-term survival by preparing the body to handle threats, long-term elevation of this hormone can have damaging effects on the reproductive system, libido, hormone production, and urinary tract function. It does this by suppressing the hypothalamic, pituitary, gonadal HPG axis, the system responsible for producing sex hormones like testosterone, estrogen, and progesterone. As cortisol levels rise, the brain inhibits the release of gonadotropin, releasing hormone GnRH, which then reduces luteinizing hormone LH and follicle-stimulating hormone FSH, effectively turning down the dial on sexual and reproductive function. In both men and women, this can lead to decreased libido, erectile dysfunction, menstrual irregularities, and even infertility. It also affects the urinary system. Stress increases muscle tension, including in the pelvic floor, which can exacerbate issues like urinary urgency, incontinence, and interstitial cystitis. Moreover, stress reduces the immune system's resilience, increasing vulnerability to infections, including urinary tract infections, UTIs in women, and prostatitis in men. The nervous system shifts into a sympathetic, dominant state, commonly referred to as fight or flight, which is inherently incompatible with the parasympathetic activation required for sexual arousal, orgasm, and proper bladder control. Sexual function requires relaxation, presence, and a sense of safety. When the brain is constantly scanning for threats, these systems become inhibited. Fortunately, there are powerful science-backed tools to help regulate the stress response and restore balance to the nervous and hormonal systems. One of the most effective is the use of physiological sighs. This is a natural breathing pattern composed of 2 inhales through the nose, one long and one short, followed by a slow, extended exhale through the mouth. This type of breathing is hardwired into the human nervous system and has been shown in laboratory studies to rapidly reduce levels of carbon dioxide in the blood, slow the heart rate, and activate the parasympathetic nervous system. Just 1 to 3 rounds of this breathing can reduce anxiety and reset the internal stress response in under a minute. When practiced regularly, it serves as a powerful tool to maintain a low-stress physiological baseline throughout the day. Another important strategy is increasing vagal tone. The vagus nerve is the main conduit of parasympathetic signals in the body. Activities like humming, chanting, cold exposure, deep diaphragmatic breathing, and even certain forms of singing can stimulate the vagus nerve and bring the body into a more relaxed, receptive state. This is the state required for not only optimal sexual performance and desire, but also for effective bladder control and urinary function. High vagal tone has been associated with greater emotional regulation, lower inflammation, and improved sexual satisfaction. Mindfulness and meditation practices also play a critical role. They help increase awareness of bodily states and reduce the automatic reactivity to stressful stimuli. Functional MRI studies show that even brief periods of mindfulness practice decrease activity in the amygdala, the brain's threat detection center, while increasing connectivity in the prefrontal cortex, which governs rational decision-making and emotional regulation. This creates a neurobiological foundation for reducing stress at the source before it can impact hormonal and urological systems. Physical exercise, when applied appropriately, is another way to buffer against stress. Moderate intensity cardiovascular training and resistance exercises lower baseline cortisol and increase endorphins and brain-derived neurotrophic factor BDNF, which support both mood and hormonal function. However, overtraining or excessive high-intensity workouts can have the opposite effect, increasing cortisol and reducing testosterone or estrogen levels. Therefore, it is essential to tailor exercise intensity and duration to the individual's recovery capacity and stress load. Lastly, social connection and physical touch have measurable effects on stress reduction and hormonal balance. Oxytocin, sometimes referred to as the bonding hormone, is released during physical affection and plays a role in lowering cortisol, improving mood, and enhancing sexual satisfaction. Intimate and emotionally safe relationships, both romantic and platonic, provide a buffer against stress and help regulate the nervous system in powerful ways. Ultimately, managing stress is not just about feeling better mentally. It is a critical factor in maintaining sexual vitality and urinary health. By using deliberate tools to calm the nervous system and restore hormonal harmony, individuals can protect and even enhance their reproductive and urological function over time. Nutrition is one of the most powerful levers available for improving sexual and urological health, yet it's often overlooked in favor of quick fixes or pharmaceutical interventions. At the cellular level, the production of sex hormones like testosterone, estrogen, and progesterone relies on a steady supply of specific micronutrients, healthy fats, and amino acids. Without adequate intake of these essential building blocks, hormone synthesis becomes impaired, leading to a cascade of dysfunction that includes lowered libido, erectile difficulties, menstrual irregularities, infertility, and urinary problems. Zinc, for example, is critical for testosterone production in men and ovulation in women. It also plays a role in maintaining the integrity of the prostate and urinary tract. Magnesium is essential for the regulation of the hypothalamic, pituitary, gonadal axis, supporting calm nervous system activity and promoting deep sleep, both of which indirectly support sexual function. Omega-3 fatty acids reduce systemic inflammation and support healthy cell membranes, including those of hormone-producing glands and reproductive tissues. B-complex vitamins, particularly B6 and B12, are involved in methylation processes necessary for hormone metabolism and neurological health. A well-balanced diet that includes lean proteins, complex carbohydrates, healthy fats, and plenty of fruits and vegetables provides the necessary substrates for healthy hormonal balance. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that help the liver metabolize and eliminate excess estrogen, which is particularly beneficial in preventing estrogen dominance in both men and women. Fermented foods such as yogurt, kefir, kimchi, and sauerkraut support gut health. And since the gut microbiome plays a direct role in hormone regulation and vitamin synthesis, a diverse and well-functioning gut is vital for long-term sexual and urinary health. In addition to foundational nutrition, evidence-based supplementation can offer targeted support for individuals experiencing sexual or hormonal dysfunction. Tongkat Ali, a root native to Southeast Asia, has been shown to increase testosterone levels in both clinical and preclinical studies by lowering sex hormone, binding globulin SHBG, and enhancing free testosterone. Ashwagandha, an adaptogenic herb from Ayurvedic medicine, reduces cortisol, increases stress resilience, and has been linked to improved semen quality and testosterone in men, and better mood and libido in women. Maca root, native to Peru, is rich in amino acids and plant sterols, and has been used to enhance sexual desire, stamina, and fertility without altering hormone levels, making it especially useful in cases where libido is low, but hormones are within normal range. For urinary health, supplements like saw palmetto can help reduce symptoms of benign prostatic hyperplasia (BPH) in men by inhibiting the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone DHT, a more potent androgen associated with prostate enlargement. In women, cranberry extract has long been used to prevent urinary tract infections, but more recent research supports the use of D-mannose, a naturally occurring sugar that helps prevent harmful bacteria from adhering to the bladder walls. Additionally, adequate hydration is essential to flush toxins, support kidney function, and maintain optimal urinary flow. Dehydration can lead to concentrated urine, which irritates the bladder lining and increases the risk of infection or discomfort. However, it's not just about what to add, it's also about what to avoid. Diets high in processed sugars, trans fats, alcohol, and ultra-processed foods disrupt hormonal balance, increase inflammation, and negatively affect the gut microbiome. Excessive alcohol intake reduces testosterone levels, impairs sexual performance, and irritates the urinary tract. Highly processed foods often contain endocrine, disrupting chemicals such as BPA and phthalates, which can mimic or block natural hormones and interfere with sexual development and function. Intermittent fasting and time-restricted eating have also emerged as tools for improving insulin sensitivity, reducing inflammation, and optimizing hormone production. For example, fasting periods of 12 to 16 hours can enhance autophagy, a cellular cleanup process that supports tissue health, including in the reproductive organs. Still, fasting should be approached cautiously, especially in women, as excessive caloric restriction can disrupt the menstrual cycle and lower fertility. Ultimately, nutrition and supplementation form the biochemical foundation of sexual and urological health. When approached with intention and consistency, they support not only the raw materials needed for hormone production and tissue health, but also the regulation of the systems that govern desire, performance, and resilience. Proper nourishment tells the body it is safe, stable, and ready to thrive, conditions under which sexual vitality and urological function are naturally restored. Physical movement and structured exercise routines play an essential role in supporting sexual vitality and urological health across all stages of life. This is not only due to their benefits on cardiovascular and metabolic systems, but because of their direct impact on hormone levels, blood flow, nervous system regulation, and tissue integrity. In males, resistance training has been shown to increase testosterone levels naturally. When performed consistently, using moderate to heavy weights with sufficient recovery, this kind of training activates anabolic pathways that promote the release of growth hormone and testosterone, both critical for sexual desire, erectile function, muscle mass, and energy. In females, a combination of resistance training and low to moderate intensity cardiovascular activity helps balance estrogen and progesterone, supports mood regulation, and improves pelvic floor stability, which is essential for both sexual satisfaction and urinary continence. Blood flow is a key mechanism linking exercise to sexual health. During arousal, blood needs to flow freely to the genitals, whether to the penis in males or the clitoris and vaginal walls in females. Physical activity conditions the vascular system to respond more efficiently, reducing the risk of endothelial dysfunction, a major contributor to erectile dysfunction and poor genital sensation. Aerobic exercises like brisk walking, swimming, or cycling increase nitric oxide availability in the blood vessels, which enhances vasodilation and promotes better circulation. This not only improves genital responsiveness, but also strengthens the bladder and surrounding tissues by ensuring they receive adequate oxygen and nutrients. Good circulation helps prevent atrophy of the pelvic region, which becomes especially important with aging. Another essential aspect of physical activity is its influence on the nervous system, particularly in modulating the balance between sympathetic and parasympathetic tone. The sympathetic nervous system, which governs the fight or flight response, is necessary for ejaculation in men and orgasm in women, while the parasympathetic system governs arousal and lubrication. A body that is conditioned through regular movement has better autonomic flexibility. It can shift between these states with greater ease. This means improved arousal, orgasmic function, and control over urinary urgency or leakage. Yoga, Tai Chi, and mobility exercises not only support this flexibility, but also improve pelvic awareness and muscular control. Certain yoga poses, such as bridge pose, cobra pose, and deep squats, activate and strengthen the pelvic floor muscles, helping to prevent dysfunctions like incontinence and pelvic pain. The pelvic floor plays a vital but often underappreciated role in sexual and urinary health. In both males and females, these muscles support the bladder, rectum, and reproductive organs. When these muscles are weak, tight, or imbalanced, issues such as erectile dysfunction, decreased vaginal sensation, painful intercourse, urinary incontinence, and prolapse can occur. Specific training of these muscles through Kegel exercises or guided pelvic floor physiotherapy can dramatically improve performance and satisfaction. For example, in men, strengthening the pelvic floor has been shown to improve ejaculatory control and erection rigidity. In women, improved tone and awareness in these muscles enhances sensation during intercourse and supports bladder function during physical stress, such as coughing or running. In addition to structured workouts, non-exercise activity throughout the day, such as walking, standing, stretching, or taking the stairs, supports insulin sensitivity and reduces inflammation, both of which are vital for hormonal and urological function. Sedentary behavior, on the other hand, is linked with lower testosterone, erectile difficulties, menstrual irregularities, and increased urinary tract issues. Just increasing step count or breaking up long sitting periods with movement can create measurable improvements in hormonal balance and pelvic blood flow. Recovery is equally important. Overtraining or excessive physical exertion without rest can elevate cortisol levels, suppress testosterone and estrogen, and impair libido and sexual performance. Therefore, Listening to the body's signals and incorporating restorative practices like stretching, sleep optimization, and parasympathetic recovery techniques ensures that exercise enhances rather than depletes sexual and urinary function. High-quality sleep, adequate protein intake, and hydration are critical components of this recovery process and must accompany any movement regimen to maintain hormonal and tissue health. Ultimately, physical movement is a form of signaling. Every time the body is moved intentionally, it tells the brain that the organism is alive, capable, and thriving. This activates cascades of hormonal, neurological, and vascular changes that support reproduction, vitality, and resilience. The body begins to interpret this as readiness for connection, pleasure, and performance. Movement is not just about strength or endurance. It's a profound tool for awakening the biological systems that underlie human intimacy and vitality.